Hi guys, welcome to another episode of Health Geeks podcast. Today we're going to find out more about health screening with Dr. Ethan from Fullerton Health. Before we start, just a quick announcement. You can now unlock discounts for health products and services, saving you more than $1,000 annually in healthcare spending just by following our podcast. Simply head to allwin.co to find the knowledge questions based off our content. Answer them correctly and you'll earn the discounts. Only at allwin.co. Firstly, Dr. Ethan, thank you for your time.
Thank you, Barry.
First question to you is, apart from or before talking to a doctor, what is a useful decision framework to determine if I should go for health screening?
I think, of course, the most important thing is for anybody thinking of doing health screening is whether you have any health concerns, right? And the other part is what is your current health status? And of course, certain things like your age and general health risk. So those are usually the things that for a person to start talking to a doctor about health screening, these are some of the things that maybe they'll also think through themselves. Yeah.
So specifically, what are some things that we need to pre-qualify ourselves before we talk to a doctor?
I don't think there's actually a pre-qualification. Generally, there are some rules for health screening, right? Most healthy people don't need health screening on a regular basis. And health screening can be done opportunistic or kind of a regular thing. So opportunistic health screening could be happening when you are, let's say, going for a major event. Like it happens, like say we go for employment screening. This is a form of medical or health screening in that sense, but it has a very specific purpose to make sure that you're fit for certain activities or fit for work, right? So of course, if you're also participating in some sporting events, there will sometimes be also a health screening or medical screening to make sure you are actually fit enough or you are not in any major risk when it comes to those events. So typical examples would be, let's say, some of the ultra marathon races, even usual marathons, they would also ask you to maybe have a medical waiver if you are past a certain age or if you have certain medical history. So those are the things where it's more opportunistic or incidental, depending on certain events that's happening. Then there's, of course, the more general kind of health screening. And those usually we reserved it because for a large group of population that has reached a certain milestones in their life. So generally it's age-based, and these are usually depending on, let's say, if you reach 35 or 45, 50 years old or 60 years old. So those are the general kind of milestones age, because we know that as a person age, you may be more prone to certain diseases and certain problems happening. And so it is something that's recommended for a person, general lay person to do.
Yeah. So at each age, just now you mentioned 35, 45. Yeah. What exactly?
I think this really depends on what you're looking at, okay? So one of the common things that people think that all health screening is the same, right? It's quite a common misconception. Well, actually, it is not. Health screening is actually an area in medicine that's actually very fraught with a lot of medical, legal, and ethical issues, right? I mean, a simple example would be, if I screen and find something wrong, am I obliged to treat? And am I obliged to even inform you, right? So that there is all this interplay, because sometimes if I screen and I find something wrong, I'm actually, as a duty of care, as a doctor, I should actually look into it, investigate. But there are also times when, in fact, very often, some of these are very innocuous abnormalities, right? They are not something that will jump out and say, oh, I must do something about it. So there is that conundrum of, say, if you screen a lot, will we find a lot of false positives? And then will we have to start treating a lot of people, right? So that's always the case with health screening. So we are very careful when we advocate for screening of certain things. We don't want to screen too many people, find too many false positives, and end up treating a lot of people when they don't need treatment. At the same time, you don't want to miss people who should be treated, right? So health screening is always done with the risk category in mind. if we assess that you are high risk, then certain screening should be done at certain kind of a frequency, right? Or intensity, or the right kind of screening tool should be used. Because you can screen in many ways. You can do a blood test, you can do more invasive investigation. So there are many kinds of screening to be done. So screening is not as simple as most people think, or just take a blood test and that's it, right? Screening as a concept in medicine is actually fairly complicated. And so we will advocate for the right tool, or we advise the patient to go for a certain test that has a certain sensitivity in your particular risk category. Now, if I were to use the wrong tool in the wrong risk category, your results are going to be very different. And sometimes it may mean that the false positive, false negative rates are very off. And it also affects your interpretation. So it's not as simple as just saying, just do a blood test or not. But that's what most people, most laymen commonly encounter, right? They go to a health screening center, just do a panel. They go to the executive health screening and do. It by and large, we do this because, the blood tests and the tests that we put into those screening panels are very run-of-the-mill. They are useful for catching some of the common things that happen commonly, but it may not be applicable for everybody, right? And like we were talking about the age band, the age band also comes because of different national recommendations or global recommendations on what are age-appropriate screening to be done. Let's say for colorectal screening, right? For most people, it starts at 50 years old, or for some people, it starts at 40 years old, right? Some people start even earlier. But the different kind of screening also means that if I'm just doing a blood test, which is taking a stool sample, versus doing a colonoscopy, those are also, both are screening tests, but has different risk profile and different sensitivity, and you pick up different things as well. So we need to know at what point we should be using which tool. Right? So that's the complexity of health screening. Right? Yeah.
So coming back to the age thing, and perhaps this is relevant to myself because I'm 33, I'm approaching 35 soon.
Okay.
I'm part of this conundrum whether I should go for screening.
Okay, so 35, if you're a Singaporean male, you probably know that at 35 years, if you're still eligible for IPPT, you have to go do certain screening, right?
Yes.
Okay, but this is actually not global or international recommendation per se. It is actually more because MINDEF mandates that you need to do certain physical activities. And so as a safety measure, they ask all the males above 35 who are still eligible to take IPPT to do some basic tests to just make sure you do not have increased cardiovascular risk, heart risk, for certain cardiac events to happen if you push yourself too much, right? So those are actually basic health screening, and those will fall under kind of opportunistic, not so much a global or international recommendation, but just because as a requirement as an NS man, you have to do this. That's why you go for health screening. But beyond that, at 35, we don't particularly think you need much medical health screening unless within your family history or your exposure or your lifestyle history, there are certain things that's flagged up to be high risk.
Yeah, speaking of which, one of my questions I wanted to ask is related to family history.
Yeah.
What sort of conditions should someone look out for?
Okay. So actually, there's quite a varied number of conditions. Most of them are, of course, cancers, right? Because there are quite a number of cancers that are hereditary. If we think about a family history, we usually ask who in the family has cancers and at what age did they have cancer. Because if the cancer happened when somebody is 70 or 80 years old, that's probably age-related rather than a genetic cause itself. Because we know that as you get older, your risk of getting cancer, whatever cancer, is higher. But if somebody in the family gets cancer at a very young age, let's say 20 or 30 years old, right, or even up to 40 years, we will think there is a significant genetic component that we may need to investigate. And generally, if there are two or more family members along this blood relation that has that, then we think, hey, this is a significant history. You might be at increased risk. We should maybe start screening you earlier. So things like breast, colorectal cancers, those are common. But even other cancers, uterine, that means womb cancers, ovarian cancer, there are certain genetic links as well. Those are some of the most common ones that we find. Of course, there are others, rarer cancers, but generally, if you see that there's a pattern of certain cancers appearing, we may ask the person to screen for those cancers earlier. Right. There are also other diseases that are not cancers, like thalassemia. And thalassemia, usually you will know it because nowadays we have a thalassemia registry. We screen people for it. In KK Hospital, they will also do the screening. When women get pregnant, they will do some screening for all these things. So this is usually not an issue. But there are, of course, other hereditary problems like heart conditions, early cardiac death. We will ask, has anybody in the family suddenly died at a very young age? So that is also a signal to say maybe there are certain things we need to check for in the heart and then pick it up from there.
So apart from this, is the general recommendation to go for screening 35 at 25, and how regular?
Okay, so there are actually, of course, the national guidelines in screening, right? So we have the Screen for Life, and they basically cover a few things. The Screen for Life it cover hypertension, high blood pressure, diabetes, cholesterol or lipid problem, and also obesity. They also cover cervical cancer, colorectal cancer, and breast cancer, right? Breast and cervical are obvious women problems, right? Colorectal is common in both men and women. So at certain age and milestones, for example, for most women, we will say, okay, start doing your mammograms yearly at a certain age, right? Generally, it's 30 years old or 40 years old, depending on which guideline you use. But in Singapore, we do tell people to do their annual screen at a certain age for that. So there is always some guidelines that we use to get women to do the screening. But for each specific condition or disease, there may be things that it's not just seeing the doctor and doing the screening. Just like breast cancer screening, most of the time it's doing your annual mammogram. But we will also tell women to do their own self-check. So check their breast and also go to the doctor if they find or encounter any problem and do a checkup. So those are also, in a way, a screening kind of tool or program to advocate for.
Just now you mentioned briefly some misconceptions about screening.
Oh, yeah.
Yeah. Would you like to elaborate more? Because I'll be curious.
Yeah, so I think we talked quite a bit about that just now. People always think that health screening is, number one, is just blood tests. Right? And as we have talked about it, it's actually a lot more things than just blood tests. It can be stool tests, urine tests, or it can be scopes, or sometimes it can be other things, right? And sometimes it can be as simple as a manual check or health check. Like for men, for testicular cancer, we just ask them to do feel their scrotum when they're showering or something once in a while to make sure that there are no unusual lumps that could be alarming. So self checks is a way of simple screening as well, right? So not all screening will mean it involves a blood test, although that's the common misconception. Right? The other misconception that I think most people have is that it's a one-size-fits-all. Again, as we talked about it, there's no one-size-fits-all because everybody's risk profile is different. I may not be doing, for two persons at the same age coming to me, even if they're the same gender and everything, I may not be ordering the same test for them simply because their lifestyle, exposure, family history, all these things that we talked about may be different. Somebody with a strong family history of colorectal cancer and all that, I might be doing colorectal screening much earlier for him than compared to the other guy without it. So even at the same age, the screening test and tools we use may not be the same for everyone. There is something that we broadly cover, and those are the common ones you think about, or do a blood test and all that. But like I said, health screening is quite a lot more varied and complex. And then I think the third one is that a lot of screening tests and tools needs to be matched to the right risk profile. Just because it's a screening tool doesn't mean it's applicable to everyone. Now I think it's very popular. They have all this new cancer screening, liquid biopsy and all this, but they're not applicable to everybody and they should not be in general use. Because if you use it in the wrong population, you might start picking up a lot more false positives and you may actually cause people a lot more worry. Can you imagine I do a cancer test on you and tell you you're cancer, right? You'll be like, what's happening? And you'll be very scared. Then you go and maybe go to see an oncologist, and then after many tests and say, hey, actually there's no tag. Then you will be very angry and very frustrated, right?
Yep.
So I think that's why testing needs to be done very carefully, and especially the ones where there's more complexity involved. It should not be anyhow administered, right? The simple ones, usually that's not a problem, like the blood test, manual checks, mammogram. Those are usually quite run-of-the-mill, and those are usually we have used them for many years, many decades. So we know their kind of the limitations, right? But the newer ones are sometimes the ones that we have a lot of trouble figuring out, even as doctors, like which are the right patients to use this on.
Now, apart from the things you just mentioned, I'm also curious about, is there a thing as over-screening? What are some health risks over-screening or just screening, right?
Okay, so like I said, when we screen, you're actually obliged to follow up and treat if you find something wrong, right? So sometimes you do have patients coming and say, oh, I want to do this, and you say that, okay, maybe for your age and risk profile and everything, it's not a good idea to do this screening, because if we find something, we have to, and we know that in certain age groups, you might see minor variations or minor highs or lows, but if we start investigating every one of them, it could mean that your cost will go up very much. So we will say, okay, even if, let's say, for a person without any health risk or health problems, we will advise what are some of the more suitable things to do. For example, right, if a person has come in to do they say, oh, I want to do this screening test, and it has a lot of cancer markers, right? And that was the controversy of quite a few years ago, where people were using cancer markers to screen for cancers. And you find that actually cancer markers is not always the best tool to use. It can be useful in some scenarios and for some cancer, but generally it's a very blunt screening tool. Very high, or high to some extent, may be alarming, but actually may not be caused by cancer. May be caused by other, maybe an infection or inflammation or something. So that posed quite a bit of issue, and actually MOH stepped in and say, okay, this is how we should be using cancer markers. So I think we have to be careful with some of these tests, because if you start having too much of this test and then you tell people, hey, you have cancer, and you send you CH, I think it's very scary for people, right? But on the other hand, you also don't want to under-investigate and miss a cancer as well. So sometimes it's not an easy call to make when to investigate more and when to do that. We will usually look at the risk profile. We will ask for any symptoms, any concerns, or anything that's unusual, and then we will make a decision from there.
Yeah, this is a lot more complicated than I thought.
Yes, I think most people don't realize that there is actually quite a lot of things to consider for health screening. Because you go to a health screening center, right, and then they say, oh, which package do you want, right? Yeah. It's like, oh, I want this package. But at the end of the day, even if we give you a standard package, right, and in Fullerton, we do a lot of health screening as well. Our doctors will, at the end of the day, still have to go through the results and look at, because as part of the health package, you still do a medical examination and everything. At the end of the day, the doctors still have to sit down, look at all your results and say, does this make sense? Or with this kind of result, is this person actually at high risk or something else? I may have to order more tests. So you will see that sometimes after the health screening, the first health screening, doctor will call you back and say, hey, I think we have a little bit of concern here. Let's look at this, and maybe we need to investigate more of this. Or the doctor may say, yeah, this one actually not a big concern for you, because you don't have any other risk factors. The other results don't collaborate to show that this is a concern, right? So blood results and all this health screening results cannot be taken out of context and cannot be interpreted in isolation. They should always be interpreted with the whole person in mind, right? So that is the part of the complexity of health screening. Yeah.
Thanks for sharing. Before we round off the session, is there anything you'd like to share that I have missed out?
No, but I just want to say that I think everybody now probably has heard of HealthierSG, right? And I think that's a very good push towards preventive health and preventive lifestyle in that sense, right? And health screening is actually very key to this, because health screening is really about picking things up early so that you can treat them at an earlier stage, whether it's cancer or any other condition, right? The earlier you treat them, the better chance of recovery and the cheaper, and you save a lot more cost in the long term, right? Imagine cancer, if you catch it, and that I think it's a lot of the fear for a lot of people, right? Especially maybe the older generation. So you speak to different generation of people, they have different concerns about health screening, right? And that's one thing that I think it's also an area of that we need to talk about. Because if you want to push towards preventive, you need to tackle the challenges of why a lot of people are still not coming for health screening. Health screening is actually very important, right? If you think about it, if you can pick something up easily, or detect a disease earlier, you can treat it faster, maybe you can get over it and it can be cured, right? Whereas if you maybe treat it at a later stage, it's maybe more difficult to treat and difficult to actually cure you, and the cost is much higher. Cancer is a very good example. But you have to understand why people don't come forward for health screening. We have health screening for so many decades, and still, even for, let's say, breast cancer screening, we know that maybe more than half of the eligible women eligible for breast cancer screening and mammogram still don't come forward for it, right? So the question is why, right? Why is there still that stigma or still the misconception or the fear? And if you actually talk to the different groups of people, the most common thing is, I don't think it applies to me, right? Or, I don't want to know already, what can I do? So that's where the education bits may come in, right? Then, of course, they are the ones who scared because maybe they do it at the workplace and they don't want their employers to find out or the HR to find out. So that's also to allay their fears that this is strictly medical confidential. This day and age, if you do it in a workplace setting, employers cannot have access to your medical information. That's very, very clear. Unless it impacts your ability to do work, then that's a different story. But most other medical conditions should not, right? So your HR or employers will not know. Then, of course, there's the other concern about, hey, if I screen and I find something, then next time my insurance won't cover me for this, right? And that's a very big worry. But of course, that one is not as easy thing to answer, and there is a lot more work being done in the area. I think insurers are also realizing that just because I pick up something doesn't mean it's not treatable and the person is condemned to suffer for the rest of his life, right? I think the insurance world is also moving towards, okay, if you detect early and you're compliant to your treatment and you do all the things, maybe there's a way to incentivize you to better behavior, right? So I think screening, health screening and early screening and detection, it's something that's very key, but it takes all the stakeholders in the healthcare ecosystem and even payers and everybody to understand all these issues behind it and work it out. Otherwise, I think you will always have a lot of obstacles and hurdles for people to take up the health screenings.
Thanks so much for sharing.
Yeah,
If you guys have any questions, please feel free to reach out to any of us. We will be happy to answer.
Yeah, we will.
That's all for this episode. Till next time, take care.